Welcome to our pharmacy. I'm pharmacist Fatma. How can I help you?
Excuse me? I'm new here. And I've been hearing a lot of talk about something called the pill from some of my classmates. I'm not really sure what it is or how it works. Can you help me?
Of course. The pill you're hearing about is probably the oral contraceptive pill. It's a type of medication that helps prevent pregnancy. Would you like me to explain how it works?
Yes, please.
Okay, now, I'll talk about the oral contraceptive pills. It is mainly used to prevent pregnancy, but they can also be used in acne and menstrual disorders. It contains two hormones, estrogen and progestogen. Progestogen is hormone made in a lab that works like progesterone, a natural hormone your body produces. They both stop ovulation by preventing your ovaries from releasing an egg. So there's nothing for sperm to fertilize, as well as stabilizing the lining of the uterus.
How do I take the pill? Like, how often and when do I start?
Great question. The pill needs to be taken once a day, every day at around the same time, or as close to the same time as possible. It's important to take it in the order shown on the pack. You take one pill every day for 28 days without skipping. Some of those pills may be non-hormonal, placebo pills, but you still take them so you stay in the habit.
When do I start taking the first one?
You should start the pill on the first day of your period. That's the first day you start bleeding. That gives you the best protection from the beginning. After that, just keep taking one pill each day, and when you finish one pack, start the next one right away the next day. No break in between.
Got it. Same time every day, no skipping, and start on day 1 of my period.
Exactly. And setting a daily reminder on your phone can help you stay on track.
Is the pill 100% effective?
The oral contraceptive pill is 99.7% effective at preventing pregnancy when taken correctly. However, it's important to remember that about 9 out of 100 women using the pill might still get pregnant due to different reasons.
What kind of reasons?
Well, if you miss a pill, or if you're more than 24 hours late taking a pill, that can reduce its effectiveness. Also, if you haven't taken 7 hormone pills in a row, or if you vomit or have diarrhea shortly after taking the pill, it might not work properly. And finally, some medicines like anti-epilepsy medications can affect how well the pill works.
Okay, so what do I do if that happens?
If any of these situations happen, here's what you should do. Keep taking your pill daily as usual. Use another method of contraception, like condoms, until you've taken 7 active pills in a row. If you missed a pill during the last 7 days of active pills, finish the rest of the active pills at their time in your current pack, then start a new pack immediately without a break. If the missed pill was in the first 7 days of active pills and you had unprotected sex during or after that time, you should consider emergency contraceptive pills to reduce the risk of pregnancy, and you can find them here in our pharmacy.
Got it. So just keep taking the pills and use condoms if something goes wrong. That makes sense. Is the pill safe for everyone? Or are there people who shouldn't take it?
That's a really good question. While the combined oral contraceptive pill is safe for many people, there are some medical conditions where it might not be suitable, or where you'd need to speak to a doctor first.
Like what kind of conditions?
Here are some examples you should be aware of and should be checked with a doctor. If you have unexplained vaginal bleeding, meaning bleeding that isn't part of your usual period, if you've had breast cancer or there's a strong family history of it, the pill might make things worse because it's linked to hormone levels. If you suffer from migraines, especially with aura, seeing flashes or patterns before the headache, the pill could increase your risk of stroke. If you smoke, especially if you're over 35, the risk of serious blood clots and heart problems increases. It's best to quit smoking if you're considering the pill. If you have trouble absorbing nutrients, like with certain digestive conditions, the pill might not work properly. And if you or a close family member has had a blood clot, especially before the age of 45,
Wow, I didn't know all that. So I should talk to a doctor before starting it.
yes, exactly. Your doctor can review your medical history, maybe do a few checks, and help you decide if the pill is right for you, or suggest another option if needed.
What are the side effects of the pill? Are there any that I should really be worried about?
It's normal to wonder about side effects. Most people feel fine after a few months, but there are a few things you might notice when you first start taking it. Don't worry, your body often gets used to it after about 3 months. Here's what you might experience, especially in the beginning: irregular bleeding, like spotting or breakthrough bleeding between periods. Missed periods, which can happen for a short time, especially during the first few months. Nausea or vomiting, which can be common at first. Breast tenderness or sore breasts. Headaches. Mood changes like feeling more emotional or stressed. Changes in libido, your interest in sex. Increased blood pressure, which is usually mild but worth monitoring. Acne or skin changes, especially if you're prone to breakouts. Thrush, a yeast infection, can sometimes happen as well. And if irregular bleeding still occurs after 3 months, you need to see a doctor to investigate the cause.
Okay, so if any of those things happen, I should see a doctor right away?
Exactly. If you're ever unsure, it's always better to be safe and talk to a healthcare professional. But most people don't experience serious side effects. And for many, the benefits of the pill really outweigh the risks.
Are there any health benefits to the pill besides preventing pregnancy?
One of the main benefits is that it's a very effective way to prevent pregnancy. And that also means avoiding the potential complications that can come with an unplanned pregnancy. The pill can also help make your periods more regular and often lighter, which can reduce the amount of blood you lose and help lower the risk of iron deficiency. In addition, it lowers the chance of developing ovarian cysts and pelvic inflammatory disease, which are both common concerns. And something many people don't realize: the pill also reduces your risk of ovarian and uterine cancers. Even better, that protective effect can last for 15 years or more after you stop taking it.
Thank you so much for taking the time to explain everything. I feel a lot more confident now, and I really appreciate how clearly you answered my questions.
You're very welcome. I'm glad I could help. It's completely normal to have questions, especially when you're in a new country and navigating a different health system. You're doing the right thing by asking. I've also found a few reliable Australian resources you can read later, like from the Royal Women's Hospital, Family Planning Australia, and a few videos. These go into more detail if you'd like to explore further. I'll print out the links for you or send them to your email, whichever works best. And if you have any more questions, feel free to come back in. We're always here to help. Here are the references. Thank you guys for watching.